Well, right now we don't have a lot of methodology that is very concrete in terms of helping us to diagnose a concussion. We know, for example, with the measures that we are currently doing in concussion, where we look at brain networks, that these networks are altered immediately after concussion, and we can see how long it seems to take before they come back to normal. So our dream for the future is to be able to use something like an imaging biomarker to make an immediate diagnosis, and also to be able to follow them up over time and determine when it would be safe for them to go back to work or go back to play. I'm Ravi Menon. I'm the Canada Research Chair in Functional Magnetic Resonance Imaging at Western, and I want to know how your brain works.
My hopes for our research in the context of concussions is to understand how we can get exercise integrated into lifestyles of people with brain damage for their benefit. A long time ago, bed rest was considered to be the best treatment for many chronic diseases or acute diseases. We now know that's wrong. Bed rest is not always the best case, but sometimes it is. We have to know how to make these decisions. Physical exercise performed on a regular basis can improve our overall health because it improves the brain by its impact on our blood vessels in the brain, but also on the nervous systems that are coming out. The hypothesis is anyway that it would improve the rate and quality of healing. My name is Kevin Shoemaker. I'm a Canada Research Chair in the area of integrated physiology of exercise and health, and I want to understand how exercise can improve your brain.
Based on the research, I would say that we will have a method of training the neck that will decrease the incidence of concussion as well as decrease the severity of concussions that happen. And it can also be used as a screening tool to show who's going to be at higher risk for concussion than who's not. The beauty of the device is that if they don't perform well, they can train on it to improve that and improve the neck's response to concussive loads. We're not going to be able to prevent all concussions. However, if we can prevent some of them and decrease the severity of others, and that's kind of the holy grail of what we're after. My name is Theo Versteeg, and I'm a physiotherapist at Fowler County Sports Medicine Clinic. I'm also a third-year PhD candidate at Western University, and I hope to develop a method of preventing and screening for concussion that makes playing your sport safer.
In the trauma program in general, we'd like to put ourselves out of business and not have patients be injured and sustaining concussions. We'd rather prevent the injury first. Through the work that we've already done with the youth sports teams, we've been able to find out where there are some gaps in their knowledge. So one thing we found is that the youth, both boys and girls, are very knowledgeable on symptoms. They'll recognize if they've sustained a concussion, and they can seek medical attention. We also found that although they're concerned about concussions, that they also feel it's just part of the game, and so we need to help change those perceptions. We've also created the video on concussions and awareness that we're going to include in prevention programming as well as use with our social media, again, to get the message out there. I'm Tanya Cherrick-Stewart, injury epidemiologist at Lena Health Sciences Center, and I want to raise awareness about concussions to help prevent them.